Hi everyone, my name is Lexi. I'm going to be doing my Nursing 320 head to toe assessment today. This is my patient Olivia. Before we get started on my assessment, I'm just going to perform hand hygiene and then put on some gloves so we can get started. So before I start, I just want to note my patient appears to be stable. Her respirations are even and labored on room air. Her skin is pink and dry. She's not in any distress, so I'm going to continue with my assessment. So to begin, I'm going to assess her orientation so I can know what approach to take with my assessment. So what's your name?
Olivia.
Okay. Do you know where you are?
In the doctor's office.
Okay. And do you know what holiday's coming up?
Christmas.
Okay. And you know why you're here?
Yes.
Okay. So she has learned oriented times 4, so I'm going to continue with my assessment as I would for anyone that's not cognitively impaired. So to start, I'm going to inspect the head. Like I said, her skin is pink and dry. She's not diaphoretic. Her hair is not unkempt. It is neat. She doesn't have any mats. I don't see any nits or any kind of bugs or anything. So now I'm going to go ahead and palpate your scalp. Make sure I don't feel any lesions, any skin breakdown, especially here in the back. And everything here feels good. No scabs, scars, or bleeding. Next, I'm going to palpate her temporal arteries. So those are located right here on her forehead. They should not be bounding and they should not be weak. And they are normal, which is considered +2. So that is a normal finding. We don't want it to be any less or any more than that. Next, we're going to assess the cranial nerve number 5, which is the temporomandibular joint. So you just place your hands here, and I'll have you open your mouth and shut it. I don't feel or hear any clicking or any cracking, which is normal. Next, I'll have you smile for me and stick out your tongue and squeeze your eyes really hard. And that is the assessment on cranial nerve number 7. That shows me that it's intact. Her face is symmetrical. It's not drooping or anything. So that is a normal finding. Next, I'll assess the eyes. So from the exterior, I see no drainage, no bleeding. She's not tearful. Her outer eyes look pretty good. So next, I'll look in the conjunctiva. I'll pull this down, put my pen light, and they are a little bit pale and moist. I know she has a history of anemia, so that is normal for her. It's not a critical finding in a setting like this in a doctor's office. Next, I will look at the sclera, which is the whites of her eyes. They're not bloodshot, they're not bleeding, and they don't have any yellow tinge, which rules out any jaundice or hepatic problems. Next, I'll assess the pupils. So in the dark setting, the pupils should be dilated so they can absorb more light. And then I will cover this to block out any light. You can also dim the lights in a hospital setting. And then I'll shine my pen light, and they should constrict, and they do a few millimeters to light. And then they should return to normal whenever you put it down. They're both equal. They are the same size. They're round, and they contract pretty briskly, which is what we want. Next, I'll have you keep your head still, and I want you to follow my pen light. And her eyes. This is also exhibiting cranial nerves number 3, 4, and 6. Her extraocular muscles are helping her to hold her head straight and to keep her eyes from moving while keeping her head straight. And then I'll have you follow it again, and that goes to show that her accommodation is intact also. She's able to follow the pen light everywhere, so those cranial nerves are intact. Next, we will look at the ears. So I'm going to notice here there's no drainage, not on either side, no bleeding or anything. So then I will look into them. No redness or drainage here also. Next, to assess cranial nerve number 8 will be her hearing. So I will do a hearing test. For this, I will cover one of her ears, and we do what's called a whisper test. So I will whisper a word to her, and she will repeat it back to me. So I will cover this one, and
Christmas.
Okay. And then we'll go over here.
Holiday.
Okay, and she repeated the same words back to me. So her cranial nerve number 8 is intact. Next, we'll do an olfactory assessment, which is cranial nerve number 1. Make sure that she can smell, okay? So in order to do this, I'll have you go ahead and close your eyes. And I'm going to have you smell something, and you'll tell me what it is, what it smells like.
Alcohol.
Okay, and I do have an alcohol swab, so cranial nerve number 1 is intact. Now I'm going to assess for patency of her nasal passages. So first I will just go ahead and look. I don't see any significant septal deviation right now. I'll plug this side and just breathe normally. Can you breathe okay?
Mm-hmm.
Okay, we'll do it on the other side. All right, so that looks good. Everything there is within normal limits. Next, we'll look in the mouth. I'm going to go ahead and palpate your lips. Don't feel any swelling. Is that tender at all?
No.
Okay. Now I'll have you open your mouth. For this, I want to look at her teeth, her gums, her tongue, the palate, and the foot of her mouth. I don't see any teeth missing. I don't see any bleeding, any gums that are swelling. I don't see any white tinge to her tongue, which could be indicative of a fungal infection if she did have that. Everything looks within normal limits there, and we can rule out anything going on there in the mouth for any abnormal findings. Next, we're going to take a look at the neck. So here, what we're looking for is any goiter, which is enlargement of the thyroid, and for any tracheal deviation. So here, I see that there's no swelling. I'm going to go ahead and palpate her lymph nodes. Any swelling? I don't feel any. Or is that tender at all to you?
Mm-mm.
Okay. I'm going to palpate the trachea. And it's not enlarged or anything. The thyroid. And then I will palpate the trachea here. And it's not deviated to either side. Everything in the neck looks okay for that. And then we'll continue to assess the neck for any jugular vein distension, which is common with patients that have heart failure. So you can see that in patients when they're sitting in an upright position that this will be swollen. We don't see that in her. She does not have heart failure. So that is a normal finding that she has no swelling or anything there. Next, I'm going to go ahead and palpate her carotid arteries. So you want to do this one side at a time. You don't want to do it at the same time because you can occlude blood flow to the brain. And there is a 2+, which is normal, and 2+ there, which is also normal. And then to assess the neck, this is also another one of the cranial nerves. It is number 11, and I'll have you put your head up and back, side to side, and everything there looks good. And those cranial nerves look like they are intact. Next, we're going to inspect her chest and the posterior chest as well, her back. So right now, from what I can see, now if she was in the hospital and wearing a gown, I would be able to better assess this. But from what I can see, she does not have a barrel chest, which is common in people with COPD. I don't hear any stridor from where I'm at right now. I also don't see that one side or the other is raised or sunken in than the other. No signs of flail chest. Like I said earlier, her respirations are even and unlabored. So now I'm going to auscultate lung sounds. So there are 6 landmarks on the anterior body and 8 on the posterior. And every time I move my stethoscope, I'll have you just take a deep breath for me, okay? So you want to start at the top. And like I said, in the hospital, we would be doing this underneath the gown. Okay, I don't hear any adventitious lung sounds, no wheezing, no stridor, no crackles or anything. And then if you don't mind, I'll have you just go ahead and stand up and face this wall, please. The 8 landmarks that are on the back I would go ahead and show you. I'm going to put this up. You'll go from here and then down and fan out to the back. So we'll go ahead and start up here. Take a deep breath. All right, and no adventitious lung sounds in the back of the chest as well. So you can go ahead and have a seat. Also, while I'm looking at the lungs, I just want to note that her skin color doesn't have any cyanosis, any signs of respiratory damage, or anything that is urgent to take care of there. Next, we're going to go ahead and auscultate the heart sounds. So first I'll assess the apical pulse, and with the heart you want to use the bell and the diaphragm of your stethoscope. So here I'll listen to your apical pulse, which is mid-clavicular on the left side. And I hear S1 and S2 sound. She does have a heart murmur, so I can hear a little bit of a whoosh, but that is normal. It's been ruled out by all her doctors. It's nothing really to worry about, and I can only hear that with my stethoscope. I don't hear it at rest. So now I will listen to all of her heart valves, and I use the Ape to Man mnemonic, which is the shows all the valves. So we're going to start over here. This is the aortic valve. This is the pulmonic valve. This is Erb's point. This is the tricuspid valve. And then down here is the mitral valve. And again, I hear just S1 and S2 sounds. Now I will switch my stethoscope over to the bell and I will auscultate again. This just gives you a closer listen. Her heart isn't racing or anything. It sounds regular, so we can rule out any atrial fibrillation from auscultating. So her heart sounds normal. Everything looks good there. Now, if you don't mind, I'll just go ahead and have you lay down on your back. We're going to do an abdominal assessment now. So for all my patients, before I begin this assessment, I like to ask if they have any abdominal pain. I would like to ask about their bowel habits, when their last bowel movement was. When was your last bowel movement?
This morning. Okay,
so that's good. First, I'm going to go ahead and inspect the abdomen. I'm going to raise this up here. So I can see it's not distended, it's not bulging, it's not pulsating anywhere. So it looks symmetrical, and I don't see anything abnormal at a first glance. Next, I'm going to auscultate. And we're going to start here in the right lower quadrant. And I'm just going to listen. If I was in the hospital with the patient, I would listen to each quadrant for 1 full minute. And you should hear around 35 bowel sounds a minute, which is considered normal active. Anything less than that is considered hypoactive. And anything more is considered hyperactive. And like I said, I would do this for a full minute in the hospital. Everything sounds normal. They are normal active in all 4 quadrants, and they're audible. So after I auscultate, now I'm going to palpate lightly on the abdomen. Let me know if you have any pain or discomfort with this. And I'm not seeing any facial wincing. She's not saying anything, so I can tell that she's not in any pain. And then you can do some percussion. Feel for any dull spots. Feel for any dull spots or anything that's abnormal there. Next, I'll have her sit up. And now we're going to inspect her extremities. So I'm going to roll up your sleeves, okay? So here, I want to look for any peripheral damage. or neuropathy. I want to inspect the color. So like I said, her skin is pink and dry. I can press down and you can see that her cap refill is less than 2 seconds in her skin and in her fingernails. Her fingernails are not clubbed or anything. I'm going to assess skin turgor. Whenever I pinch, it goes back down fairly quickly. She has elastic skin, which can rule out any dehydration or hypovolemia. Do you have any numbness, tingling, or tenderness in your extremities?
No.
Okay. Now I'm going to assess her pulses, her radial pulses. And they are 2+. They're not bounding and they're not weak. Then I'm going to assess her lower extremities. I don't see any edema. She has no history of heart failure. So we wouldn't want to see any edema in her. Her skin turgor is also good down here. Her color is pink. She doesn't have any pallor, no purple tinted legs, which can be a result of peripheral vascular disease. I'll feel her pedal pulses, which are 2+, which if you lift your foot up here, it's kind of in between the bridge of your first 2 toes. And then I'll assess her posterior tibialis pulse here, and that is in the medial side of the ankle. And both of those are equal. They are 2+. Now I want you to close your eyes and I'm going to test your sensation. So tell me what extremity I'm touching.
Wrist.
Which one?
Left. Left knee. Right arm. Right leg.
Okay. Now we're going to test her sensation. So now I'm going to tell me if you feel a dull sensation or a sharp sensation. Okay?
Dull. Sharp.
Okay.
Dull. Dull. Sharp.
Okay. So that sensation can be decreased, especially in patients that have diabetic peripheral neuropathy. But those are normal. She answered questions appropriately, and everything looks good there. Like I said, her fingers aren't clubbed or anything. Her fingernails, which can be a sign of chronic hypoxia. Color is good. She's obviously not paralyzed. I can see that she moves all her joints, and she follows commands easily. They're also warm. They're not cool, which shows an adequate amount of blood flow. Next, we're going to assess her joint and musculoskeletal system. So I'm going to have you bend your elbows. Do this with your wrist. Hold your hands out, up and down. Same thing with your knees, okay, and your ankles. Okay, I'll have you stand up now. And I'm going to inspect the spine. If she was wearing a hospital gown, I would assess that. I'm not going to pull her shirt up for privacy reasons. I'm going to assess her spine. Don't feel any bulging, no swelling. Do you have any tenderness?
No.
Okay. And now I'll have you go ahead and bend down at the waist. Okay, and go back up and kind of just go backwards a little bit from the hips. Good job, everything. It looks like she has full range of motion. Do you have any tenderness when doing any of this? Okay. Also, while we're up here, I'm going to assess for tactile phreatitis, which is also part of the respiratory assessment. But while she's standing up, I'll have her go ahead and do it now. So now I'm going to move my hands down your back, and I'll have you repeat the phrase 99. And what I'm feeling for is any vibrations in the back, which could be an abnormal finding. So go ahead and say that.
99.
Okay.
99. 99.
Okay. And everything felt the same. I didn't feel any abnormal findings whenever assessing for that. Okay. You can go ahead and sit down. Now I'm going to also have you shrug up against my shoulders, or against my hands. Good job. All right. So her musculoskeletal system looks good. One more thing I'll assess for that before moving on is her patellar reflexes. So here you just find the tendon, which is distal to the knee. I'm going to do this, and we should see, yeah, you can see her foot is moving up. All right. So her reflexes are good. They're not hyperactive and they're not hypoactive. That's just what we want. Just a slight movement. So that shows me that her electrolyte levels are probably good and nothing is too out of whack there. And then lastly, we'll go ahead and do a neurological assessment. So also part of a neurological assessment is assessing for your pupils, which we did that earlier. They were equal, round and reactive. Her face was symmetrical. Now I'll have you squeeze my fingers as hard as you can. Those are equal. I want you to hold your hands out like this. Push up against me. Now push down. Okay. Same thing with the legs. Push up. Now push down. And then I want you to push against my hands. Okay. Now I want you to, I'm going to have you touch your nose with your finger. And then I want you to touch my finger.
With this finger?
Mm-hmm. Yeah. Okay. Continue. Back to the nose. Okay. Let's do the other hand. And you can also have your patients do them themselves by holding them out like this and going like this. So you want to go ahead and demonstrate that technique. Thank you. All right. So this seems like a normal assessment. I didn't find any abnormal findings other than maybe the heart murmur. But like I said, she's lived with that for a very long time. And it's not like a critical finding or anything. So thank you for doing my assessment with me, and have a good day.